All right, hello and welcome. You've all heard the term clinical audit thrown around, especially in dental public health. But what does it actually mean when you're in the clinic on a Tuesday morning? Well, today we're going to ditch the dry textbook definitions, we're going to get practical, and show you how to turn this powerful idea from just theory into something you can actually use to improve patient care and build your career.
So let's just jump right in. I've got a question for you. Think about your day-to-day work. What is the single most dangerous thing in your clinical practice? Seriously, take a second. What's the biggest risk?
Okay, so what did you come up with? I bet for a lot of you, the first thing that popped into your head was making a mistake, right? A clear, obvious error. But that's not it. The biggest danger isn't that one mistake you catch, learn from, and never make again. Nope, it's something a whole lot sneakier.
And there it is. The real danger, it's our blind spots. It's the little things we do every single day, maybe an outdated technique or a small inefficiency, that we don't even realize are wrong. We just do them on autopilot. And that is exactly why clinical audit is so important. It's the tool we use to systematically shine a big, bright light into those dark corners of our own practice. Okay, so if we all have these blind spots and they're the real danger, why on earth would we go looking for them? I mean, who wants to find out what they're doing wrong? Well, let's get into the why. Let's talk about that powerful drive for improvement.
And this is what I think is so cool about the whole concept. A clinical audit isn't about pointing fingers or finding fault. It's actually a tool for you. It's a chance to critically look at your own skills and get better. It's also a way to look at the whole system you're working in. And the best part? It gives you the power to make a real, tangible difference for your patients. It's the difference between just showing up and doing the job and actually shaping the quality of care.
All right, so we're sold on the why, but let's get down to brass tacks. What exactly is a clinical audit? I mean, the term gets thrown around all the time, right? So let's nail down a really clear, practical definition. Okay, look at the keywords here because they're everything. It's systematic, which means it's a planned process. This isn't just a random spot check. It's a critical analysis of quality. And the whole point, the entire reason we do it, is to reflect on and improve patient care. I really want you to get this. It is not a test you pass or fail. It's a tool for getting better. And honestly, it's a core part of our professional responsibility, a cornerstone of clinical governance. Now, this next point is absolutely crucial, especially for all you postgrads out there. People mix up audit and research all the time, but they are totally different things. Think of it like this. An audit asks, are we following the recipe correctly? It measures what you're doing right now against the known best practice recipe. Research, on the other hand, asks, can we create a better recipe? It's trying to discover brand new knowledge. So audit improves practice, research proves a new idea. And just to be super, super clear, let's talk about what an audit is not. It is not a witch hunt to find someone to blame. It's not some sneaky management trick to cut costs. It's definitely not about collecting a bunch of data just to stick it in a report that gathers dust on a shelf. And like we just said, it's not research. You have to see it for what it is, a positive, constructive way for all of us to get better at what we do. Okay, so we've got the what and the why down. Now for the fun part, the how. How do you actually do one of these things? It might sound intimidating, but I promise it's not. It's actually a pretty straightforward 5-stage cycle. Think of it as your roadmap. First up, step 1, preparation. This is so important. The key is to pick a topic that actually matters. Don't just pick the low-hanging fruit. Think about it. What are the real issues? Patient safety concerns, common complaints you keep hearing? And here's a huge tip. Whatever you choose, make sure there are good, solid guidelines you can measure against. And you've got to be honest with yourself. Pick something you can actually change. Okay, on to step 2. This is where we set the benchmark. We get really specific about what we're going to measure and what good looks like. To do that, we need to understand 2 key terms, criteria and standards. Let's break those down. First, the criterion. An easy way to remember it. The criterion is the what. It's what you're measuring, and it has to be a super clear, measurable statement. Like the example here, all radiographs must be of diagnostic quality. That's perfect. Why? Because you can look at any radiograph and give it a simple yes or no. It's not ambiguous, it's measurable. So if the criterion is the what, the standard is the how well. It's your target, your goal. And it needs to be realistic. I mean, we'd all love to be perfect and hit 100% every time, but that's often not possible. So a realistic standard might be something like 95% of radiographs will be of diagnostic quality. See, now you have a really specific, measurable target to shoot for. Step 3. This is where you roll up your sleeves and do the detective work. You systematically collect your data to see how you're actually doing compared to the standard you just set. You've got two main ways to do this. You can look backwards at old patient records, we call that retrospective data, or you can collect it as it happens, in real time, which is called concurrent data collection. All right, step 4. This is kind of the moment of truth. You've got your data, now you have to analyze it. Where did you fall short of that 95% target? But more importantly, why? You have to dig deep. Was it a training issue, a problem with the equipment? You identify those barriers, and then, this is the most important part, you create a real, concrete action plan to fix the problem. This is where you actually make things better. And that brings us to the final step, step 5. And honestly, this might be the most overlooked but most important step of all. This is what makes the change stick. See, an audit isn't a one-and-done thing. You have to go back and re-audit after you've made your changes to prove that they actually worked. That's why it's called the audit cycle. This is how you build a culture where constant improvement isn't some special project, it's just the way you do things. So there you have it, the 5-step audit cycle. But I know what you're thinking. That's great, but how does this apply to me right now as a postgrad? Fantastic question. Let's talk about how you can take this exact framework and use it to carve out your own path to improvement and really build your career. I want you to really pay attention to this idea because it's a game changer. It's called the audit research continuum. You start with a simple foundational audit. You implement some changes. You re-audit. But then maybe you find something really interesting. Something that makes you go, I wonder why that is. That little question sparked by your audit can become a full-blown research hypothesis. That can lead to translational research and, yes, even to getting published. Think about that. What starts as a small project in your own clinic can end up advancing our entire discipline.
Let me give you a real-world example. Imagine a postgrad, just like you, does an audit. They find that 15% of their clinic's implants are showing early bone loss. They dig in and find out it's a technique issue. So they implement new training, they re-audit, and boom, the problem's fixed. But they don't stop there. That initial finding becomes the seed for a full research study that eventually gets published. You see that progression? It all started with one simple audit.
So, are you feeling ready to start your own? When you're thinking about your very first audit topic, just run it through this simple 4-point checklist. 1. Is it relevant to your patients? Does it actually matter? 2. Is there a known standard you can use as your yardstick? 3. Are you actually interested in it? And 4, the big one, can you actually do something about it? If you can say yes to all 4 of those, you've got yourself a fantastic audit topic. Before we wrap up, there is one last thing we absolutely have to talk about, and it's non-negotiable: patient confidentiality. When you're doing an audit, you're looking at patient records, and you have to protect that information. All the data must be completely anonymized. Here in the UK, we follow a strict framework called the Caldecott Principles. But no matter where you are in the world, the fundamental rule is the same. Ethics and patient privacy come first. Always. So as we finish up, I want to leave you with a question to take back with you. Whether you're heading to the clinic, the university, or the hospital tomorrow morning, based on everything we've talked about today, what's the first thing in your practice that just popped into your head? That little thing you know deep down needs a closer look. Because that's it. That's where your journey of improvement begins.